And you can hear us. We've been having about an hour and a half, 2 hours worth of technical difficulties, thanks to me.
I'm a busy surgeon. This is like getting in my program here.
This is definitely a struggle, so I really appreciate anybody who's listening. If you'd like to ask us a question, please feel free to send us a little chat, and we really appreciate you being here or listening to the recording. Either way, we're super happy that you have joined us today.
So the topic we have today is smoking and obesity. These are common topics. People all know that smoking and obesity is not great for you, and it's really not good for you with surgery. But Amy brought up a pretty interesting article she read out of England. Amy, why don't you tell us about it?
Yeah, so it was on CNN, and I'll link it on our Facebook page if you guys are interested in reading it. So basically, in England, if you, in the past, let's say you needed like a knee replacement, something non-life-threatening, you needed a non-urgent or non-
what they call elective surgery. Elective surgery.
Yes. So, and you were a smoker or obese, by their definition was 40% or BMI of over 40. You were basically given counseling on stopping smoking and advice on how to lose weight, but they'd still do your surgery in most cases. However, now they've actually put in a requirement of surgeons. I think it's 8 months of smoking cessation and weight loss counseling before you can have any elective procedure.
That means if in this area of England, which we call a province, we're not even sure if they have provinces in England.
No, I think there has to be a more fanciful name for it, Dr. Martin.
Who knows?
It's a shire.
A region.
A shire.
Anyways, like if you go in with terrible knee pain and you need a knee replacement, you're not getting surgery for obese. BMI over 40 is rather large. It's morbidly obese. And smoking, obviously, people understand the problematic effects of smoking.
But they might not. I think you should go into that in a little more detail.
We will in a second, yeah. But anyways, they're like, and this is kind of really applicable to plastic surgery. We do elective surgery. We empower people. Some of our surgery results are just truly amazing, but we have to make sure the patient is in their best state before surgery, because remember, they don't absolutely need it. As much as I feel like what we do changes people's lives, it's not absolutely mandatory for obviously their health.
Right.
So
you can continue to live.
You can't without plastic surgery. I know it's a stretch, but that's the truth. So why are smoking and obesity bad? And Amy, you and I have talked about this many times with patients, but both kind of the same process, just from different angles. Smoking, especially with the nicotine, but some of the other products that are in cigarettes, decrease the blood flow to that microenvironment of healing and promote inflammation. Ultimately, you see the small blood vessels that are there to feed the area of healing with oxygen, which is absolutely necessary for normal healing, are not functioning appropriately or just not present or diminished. And that's from the nicotine and the effects of smoking itself.
Well, and I think it's important to note too, like when you do smoke, inhaling those substances gets them into your bloodstream so fast.
Right.
So it's not like something that you've eaten or consumed. When you breathe that in, all those little alveoli in your lungs are expanding, and they're getting that almost directly into your bloodstream.
Right.
So it goes really fast.
Right, and the end results is not good. Obesity, what happens is when you gain weight or you get fatter, your fat cells grow in size, but the blood vessels that are associated with those small fat cells do not grow in equal size to the equal amount to the increased size of the fat cells. And so what you create also in obesity is a low oxygen environment. Again, oxygen is absolutely necessary for healing, collagen production, which is in scar formation, to decrease inflammation locally.
Nutrients up to that healing area.
So people that are smoking and obese definitely have worse surgical outcomes. In some cases, I read 12 times worse. If you're choosing plastic surgery, you're 12 times more likely to have postoperative complications than a non-smoker. And it's pretty similar when it comes to obesity, maybe not as high. So clearly, if you're talking about an elective surgery and you're a smoker, it's probably not smart to smoke and you should stop. And if you're obese, specifically morbidly obese, you should focus on the weight loss first if possible, and then consider the plastic surgery.
Yeah, and that's really because we want to optimize our patient's outcome. It's because we do care. You know, this is not us being judgmental. We counsel our patients on these things because you're going to spend a lot of money to have surgery with Dr. Martin. We want you to have the best possible outcome. We want your recovery to be unencumbered by infection or delayed healing. So if you're going to spend money and put your confidence and your trust in us to give you the best possible outcome, we're going to make sure that you're doing your part too to get you the best possible result.
Right, and so we're not punitive. We don't discipline our patients. We love our patients. We want to help them. So when you come into your doctor's office, just be honest and upfront. There was an article in the 2013 edition of Plastic and Reconstructive Surgery, which is our professional journal, that really showed that a small percentage of patients basically straight up lie to their physicians in plastic surgery about smoking. Not really sure how that's helping you. Maybe you want the surgery so bad, but maybe you should put your life and limb ahead of looking better from a cosmetic standpoint. But the flip side of that coin is in 2017, same journal, our professional journal, showed that people that quit smoking for plastic surgery, actually 40% of those patients long-term, greater than 5 years, kept the smoking cessation going and did not take back up the habit of smoking or whatever. So clearly, if you change someone's life, if you encourage them to improve their life, and that can be with cosmetic surgery, it's going to bleed over into other parts of your life. And that's ultimately what we do. We want to encourage you, empower you to change your life. We want you to feel better. And you can feel better by having a better self-perception, by looking better. And that's going to translate into other parts of your life. And we've talked about that in previous podcasts in terms of self-perception and how that will translate mentally for you and mental health and also physical health. And there's a lot of data to support that.
Yeah, and we've seen that same, I would say that same statistic with our patients, the ones who do stop smoking. I don't know, I can't think of one who's actually come back in, for their 6 month to a year post-op visit and who's actually started smoking again. So it just kind of shows that, like, I think the same thing with weight loss too. Is okay if I kind of go into that a little bit?
Yeah,
now?
sure.
We've had patients who, they may come to see us after they've already lost a lot of weight, and they say they've lost, 70, 80 pounds. And so they're at a place where they're healthy for surgery. Like, we do their surgery, and some of these women come back in like 3 months later and they've lost so much more weight. It's like, I call this one woman the incredible shrinking woman, because it's motivational. Like, surgery it helps you see what's possible. I mean, we absolutely believe that you can achieve anything you'd like. If it's weight loss, if it's to stop smoking, anything in the world, like, if you want to achieve it, you can do it.
It's mostly up here. We see this all the time in our clinic. It's a mental perception, and it's how you talk to yourself that makes a difference. And I know that sounds very quasi and not scientific, which I'm a very scientific person. So yeah, that's kind of antithetic to being a doctor. But in reality, I see it all the time in our clinic. We have a podcast on weight loss. I mean, it's unbelievable. This woman lost 100 pounds 2 times, basically.
Yeah.
And a single mom, saved her money, lost the weight on her own, no surgery, and did plastic surgery to make all the problems that were there after being morbidly obese go away. And it is truly inspiring to hear her story. And she says every day she's thankful. Her mindset has changed. She's still a single mom, but she's lifted herself up and really changed her life around. And that is a common thread in our clinic. So people ask us all the time, what's it like being a cosmetic surgeon or a plastic surgeon? What do you do in your clinic? Do you really do anything?
Right, or do you make people look like the freaky things that they see online?
Reality show, kind of, and nothing against the Kardashian, but the Kardashian effect and all that kind of stuff. That's not it. People that come in our clinic are completely normal people that just want a little help. I mean, life can be hard. The path of life can be difficult for people. And we offer a small amount of improvement. And that little improvement, that little nugget grows, and you see it in these people and expands out. Truly remarkable. In our podcast, we're going to start bringing more of these stories out so people start understanding plastic surgery better and maybe changing the narrative a little bit. But back to things that matter more than anything is your health. Smoking and obesity, most people understand that they're not appropriate behaviors and can have ill effects in your life. But maybe, just maybe, you want to look better too. So if that's just the little nugget that gets you to stop smoking, we're all for it. And we think that there's so many resources out there now in terms of smoking cessation and weight loss. You need to consider that.
Yeah, absolutely. And we did an awesome podcast with Dr. Matthew Metz, who's in the Denver area. He does bariatric surgery. And he is not only an awesome surgeon, but like, really, his approach to patient care is so unique. He really does care about his patients and wants them to have the best life possible, which, it's easy for me to sit back and like assume that all doctors are, like you and like us, and like we want good things for our patients. But, healthcare is busy and people get, kind of shuffled through the system. So if you're in the area and you're interested in like learning more about bariatric surgery, I highly recommend checking out Dr. Matthew Metz.
Yeah, he was,
our podcast.
That was an awesome podcast.
Yeah, you can find our podcast in the iTunes store. We're just Beauty and the Surgeon, or go to our website at Jason Martin MD. And please follow us here too, because we're going to keep putting out more content like this. And we'd love to hear your questions or suggestions for what you'd like to hear about, because I think what Dr. Martin said is so true. Like, people have such, perception is everything, but the perception that people have about plastic and cosmetic surgery is very
limited.
Jaded.
And limited too.
It is, and it's what they see. It's what you see in the media, and that's not really life. I mean, we have patients who are executives and CEOs and working moms and single moms and dads, and it really,
and single guys.
Yeah, it's maybe not what you think it is.
I know. So
yeah, we want to help you guys understand what we do in more detail. So please ask us questions and follow us and subscribe.
Last caveat I want to say to this point, and then we can bury this hatchet. Healthcare is changing, and the healthcare dollar of expenditures of what we're doing in this country, there's going to be a big magnifying glass on that in the future going forward. So things like smoking cessation or quitting smoking and weight loss programs that are effective, if you're a surgery patient, are going to be more common in this country. It's only started in England because that's a single payer system that's coming here. So these are things that are absolutely going to be in the forefront of the discussion in regards to healthcare in the United States. So it's a good topic to start. It
is, and it's preventative. It really is for the best outcome.
And if you do it, maybe you just get some plastic surgery.
Right. Then you can have a tummy tuck.
You can have a tummy tuck.
Right.
All right. Thank you very much.
Thank you guys so much. I really appreciate you listening. If you made it this far, don't forget to subscribe and ask us questions. And I have to say, this is kind of a huge win if you can hear us and you can see us at the same time.
It only took us 3 hours.
We did it. We YouTube live for the first time ever. High five.
High five. This is the way this fists it out. There you go. Just keep it strong. Out. God, this hurts.